Hi friends, welcome back. Today we are discussing the pharmacology part 1. Today we are not discussing in depth into any portions, but we are discussing on the portions which are very important for the competitive exam. We are just going through the important portions coming under, especially through the aminoglycoside and the anti-amoebic drug, antileprotic drug, like that. So we can start today's session. First of all, aminoglycoside. These are a group of natural and semi-synthetic antibiotic. Among the aminoglycoside, the structure is that it is a polybasic amino group linked glycosidically with two or more amino sugar like streptidine, 2-deoxystreptamine, garosamine residues. And the first drug among this aminoglycoside is the streptomycin. Go through the important drugs coming under the aminoglycoside. The four drugs are mentioned here. These are given systemically like streptomycin, gentamicin, tobramycin, and amic acid. Whereas topical aminoglycoside include the neomycin and pharmacizate. The mechanism of action of streptomycin is very important. We want to know by which mechanism the streptomycin work. The mechanism is that the streptomycin bind to the ribosome, which will result in inhibition of the bacterial protein synthesis. Among the ribosome, the streptomycin bound to the 30S ribosome, but the other bind to the additional site of 50S subunit as well as 30S 50S interface. So it is the difference of streptomycin. Streptomycin bind to the 30S ribosome, not that. And it blocks the initiation of the protein synthesis, cause the misreading of the mRNA, which may lead to the premature termination of protein synthesis, which lead to the formation of defective or non-functional protein. So it may result in the death of the bacteria, and this is the mechanism of action. So now the streptomycin bind to the 30S ribosome. Going to the adverse reaction, the adverse reaction of streptomycin is very important because the drug that cause ototoxicity and nephrotoxicity, the option is streptomycin. Ototoxicity, that is a vestibular and cochlear dysfunction, can occur due to the 8th grade cranial nerve damage. Nephrotoxicity is also produced by the streptomycin. They get concentrated in the renal cortex and cause nephrotoxicity, which is usually reversible. That is, that may this nephrotoxicity problem be reversible that come to the initial position. But the adverse reaction, ototoxicity and nephrotoxicity is shown by the drug streptomycin. And it also have the adverse reaction like neuromuscular blocking effect, hypersensitivity reaction, and they are not safe in pregnancy that may lead to fetal ototoxicity. Neuromuscular blocking effect, telling about the streptomycin effect, they inhibit the release of acetylcholine from the motor nerve that may result in apnea and muscular paralysis. Here, this neuromuscular blocking effect is more seen in myasthenia patient. Going to the antiamoebic drug. Amoebiasis is an infection caused by the protozoa Entamoeba histolytica, and the antiamoebic drug can be classified into two categories, tissue amoebicide and luminal amoebicide. And among the tissue amoebicide may act both the intestinal and extra-intestinal amoebiasis. It includes the most important drug among the antiamoebic drug, that is a metronidazole, come under the category nitroimidazole, and also include the clinidazole and secnidazole. And the alkaloid which are used against for both intestinal and extra-intestinal amoebiasis are the emitin and dihydroemitin. Whereas for extra-intestinal amoebiasis only we can use the drug chloroquine. Going to the luminal amoebicide, it includes the amide category, example diloxanide furoate and itazoxanide, and 8-hydroxyquinone, that is quinidochlor and idoquinol, and antibiotic include the tetracycline and paramomycin sulfate. The most important drug used for the treatment of amoebiasis is a metronidazole. It is the prototype nitroimidazole used for the treatment of amoebiasis. The mechanism of action is that the nitro group of metronidazole chemically get reduced by the pyridoxine within the sensitive organism, and this reduction product appears to be responsible for killing the organism by reacting with various intracellular macromolecules. So the reduction by the pyridoxine is the basic mechanism occurring metronidazole. Coming to the clinical use of metronidazole, the main use is used against amoebiasis. It's also used for urogenital trichomoniasis, giardiasis, anaerobic infections, cancrum auris, diabetes, ulcers, vaginitis, and Helicobacter pylori infection. The most important is that the side effect of metronidazole include pancreatitis, seizures, encephalopathy, and its metabolites are mutagenic and should be avoided in pregnancy. The most important side effects include on IV injection it produces peripheral neuropathy and dull sulfiram-like reaction when taken with alcohol, that is showing the symptom of alcohol withdrawal syndrome, that is the disulfiram-like reaction. So note the side effect of metronidazole include the disulfiram-like reaction and peripheral neuropathy. Come to the drug chloroquine. It is used for the extra-intestinal amoebiasis. It is active against the trophozoite of Entamoeba histolytica only. It is having very high volume of distributions, then it is concentrated in liver, so it is effective only against hepatic amoebiasis. The other drugs include the diloxanate furoate. It is an effective luminal amoebicide and is a drug of choice for asymptomatic infection. Not it is a luminal amoebicide, not a tissue amoebicide. It is hydrolyzed to furovate ester, and the unabsorbed diloxanate is the active antiamoebic substance. Other category is the tetracycline. The oxytetracycline have a very weak direct amoebicidal action and it is useful with a luminal amoebicide in the eradication of mild to severe intestinal disease. Erythromycin also having a less effective in use in the treatment of luminal amoebiasis. Going to the other important category is antileprotic drug. Leprosy is a chronic disease caused by the bacteria Mycobacterium leprae that may cause damage to the skin and the peripheral nervous system. The disease develops slowly and results in skin deformities. The important drugs used in these conditions are the sulfone, the important one is dapsone, phenicin derivative like clofazimine, anti-tubercular drug like Rifamicin-red, another antibiotic like ofloxacin, minocycline, Clarithromycin are used to treat the lesions and deformities. Going to the antiamoebic drug. Amoebiasis is an infection caused by the protozoa Entamoeba histolytica, and the antiamoebic drug can be classified into two categories, tissue amoebicide and luminal amoebicide. And among the tissue amoebicide may act both the intestinal and extra-intestinal amoebiasis. It includes the most important drug among the antiamoebic drug, that is a metronidazole, come under the category nitroimidazole and also include the thienidazole and set. Going to the mechanism of action of dapsone, dapsone inhibits the bacterial synthesis of dihydrofolic acid through the competition with para-aminobenzoate for the active site of dihydropteroate synthetase or folate synthetase. So it inhibits basically the synthesis of dihydrofolic acid. This is used in dapsone-resistant leprosy cases, multi-drug therapy introduced, as we already said, and dapsone is administered transdermally as a gel, 5% for the acne medications. Going to the other drug, clofazimine, it is a fat-soluble phenicin dye, and it is used in combination with rifamicin and dapsone as a multi-drug therapy. The mechanism of action is that it binds to the guanine bases of bacterial DNA, thereby it blocks the template function of DNA and inhibits bacterial proliferation. It also increases the activity of the bacterial phospholipase E2 and results in release and accumulation of lysophospholipid, which are toxic and inhibit the bacterial proliferation. Going to the adverse effect of clofazimine, it produces a pink to brownish skin pigmentation. Note this color. Clofazimine produces pink to brownish color or brownish skin pigmentation, as well as similar discoloration of mostly body fluids and secretion. And these discolorations are reversible but may take months to reverse or disappear. It also causes the gastrointestinal intolerance, eosinophilic enteritis, and GI irritation. Other important drug is rifampicin. Rifampicin is used in the treatment or active against the mycobacterium strain such as COS, which causes the tuberculosis and Hansen disease. And this rifampicin, the color change is that it produces a red to orange color to the urine. So note that after for a few hours after a dose, rifampicin produces a red to orange color. It is a bactericidal antibiotic drug. Sometimes this monotherapy of rifampicin for a few days as prophylaxis against meningitis may develop resistance quickly during the long treatment of the active infection. So this is used in combination with other antibiotic. Going to the mechanism of rifampicin inhibits the DNA-dependent RNA polymerase in the bacterial cell and binding its beta unit and preventing the transcription to RNA. Its lipophilic nature makes it a good candidate for the treat the meningitis form of tuberculosis, and it distribute to the central nervous system and penetration through the blood-brain barrier. Going to the mechanism of action of dapsone, dapsone inhibits the bacterial synthesis of dihydrofolic acid through the competition with para-aminobenzoate for the active site of dihydropteroate synthetase or folate synthetase. So it inhibits basically the synthesis of dihydrofolic acid. This is used in dapsone-resistant leprosy cases. Multi-drug therapy introduced, as we already said, and dapsone is administered transdermally as a gel, 5% for the acne medications. Going to the other important drug is ethionamide. It is similar action to the INS, that is isoniazid, that act by inhibiting the mycolic acid synthesis and prevent the cell wall synthesis. It is a tuberculostatic that it will resist the growth of the drug and inhibit the growth and antileprotic drug. It is active against both extracellular and intracellular bacteria. And ADR include the nausea, vomiting, and abdominal pain. Clarithromycin is a macrolide antibiotic, and its mechanism include it bind to the subunit, that is 50S of the bacterial ribosome, and inhibit the translation of peptide. It is used as a part of combination therapy to treat the Helicobacter pylori. These are the important reactions dealing in the leprosy patient. That is, first one, the lepra reaction and sulfone syndrome. Lepra reaction is a Jarisch hexamer reaction due to the release of endotoxin from the killed bacilli. It may be mild, severe, or fatal. The sulfone syndrome is a reaction which develops 4 to 6 weeks after the dapsone treatment. May have fever, malaise, lymph node enlargement, jaundice, and anemia. By this, we come to the end of the session. Hope this session will be helpful for you to prepare for the competitive exam. If you like this video, please share and support. Thank you for watching. Thank you once again.